Content warning. If you are fearful of either snakes or medical needles, you can turn off the podcast now. Don't worry, I won't judge. But who actually am I? Well, my name is John Hammond, and today on the most significant bit, we will be talking about those things I mentioned in the disclaimer: snakes, needles, and how snakes can help make better needles. We now go to our on site consultant with some, I'm sure, very entertaining medical papers. Okay, boss wants me to cover these files for some reason. Guess there's no better place to start then. What? What is it? But I'm in the middle of something right now. Can't they wait for Well, okay, but can't someone else do it? Fine, send them in. Look, just be quiet and we can both move on quickly. Good? Good. Okay, just hold still. Get your shot ready and there. Now get going. I have more work I need to do now. Now, back to whatever this is. Oh, how very topical. As modern medicine has developed, so has the need to circumvent the body's natural methods of taking in substances and instead putting material directly into a person's bloodstream. This is done today with the use of a medical needle, a long, sharp piece of metal forced directly into a vein or artery, a process that most everyone can agree is very uncomfortable. However, the need for living things to put foreign substances into other living things predates the human race substantially. So how did Mother Nature handle this conundrum? Of all the species that have evolved to accomplish this task, snakes will be the focus for today's discussion, as they have a regularly occurring need to inject foreign material, in a snake's case, venom, into other living things. While the mechanism some snakes with larger fangs use to hold the fangs in their mouths is very interesting, that will not be the focus of our discussion today. They have to fold the fangs back with a muscle structure. It's really weird. Instead, we are here to focus on the fangs themselves. While most venomous snakes use fangs resembling current needles, with a single long, sharp object with a hollow center to allow liquid flow, some snakes, like the boom slang, use a comparatively greater amount of fangs, about 4 or 6 depending on the species, that are shorter than normal. The lack of volume in venom delivered by these shorter fangs is compensated with by the multiple fangs injecting all at once. Now, you may be wondering why I went on for a while about the minutiae of snake fang biology. Well, researchers at, and apologies for my butchering of foreign languages here, the University of Seoul, Seoul, in the Republic of Korea are working on a form of injection patch that is based on the design of boomslang fangs, or at least they were. This info is a few years out of date. This will allow for a much more comfortable experience for the patients, as there's a lot less long, comfortable metal being shoved into their bodies, and all of that prodding around for veins and arteries will no longer be necessary, as well as reducing the complexity of use for the doctors and nurses who no longer have to do that prodding. An interesting consequence of this new device is that apparently there is less need for preparatory mixing and other chemistry things when injection fluids are being prepared, due to the nature of how it is being delivered. Okay, that seems to be it. So now I can get back to my goodbye. Oh, it seems that our correspondent forgot to clean up their recording. Well, good night, everyone, I guess?